All of you come here for 3 days of learning experiences and share, receive knowledge and best practices in the spinal cord injury and disease. Then you take that knowledge and return to your hospitals to apply it in your daily care of our nation's veterans. Quality health care for spinal cord injury and disease veterans is our #1 priority at Paralyzed Veterans of America. And we thank you for your dedication and commitment to all of you in this room today.
This week, I'm going to always encourage you to be proud of what you do. You are what stands between an entire system failing and there being a future for VA. So like President Zurfluh, I want to thank you on behalf of the 20,000 veterans who are our members and the 60,000 veterans in this country. Many of them don't access VA. We're trying to change that. But they wouldn't be alive today, many of them. It wasn't that long ago that 2 years was the lifespan of somebody with a spinal cord injury. And that's been extended so that we can live normal lives. And that's only because you have clinicians, social workers, nurses, all the other professions who care enough to take up this challenge and do the hard work. So let's use this week to exchange ideas, to exchange best practices, to get re-energized about what you do. Have a great week, everyone. I look forward to this great celebration. Don't forget about our fellow Americans in the Houston and Texas area. Thank you.
I have a problem that everyone envy. We have 900 attendees this year. So that tells you the community continues to grow because of the wonderful education session that we offer and the networking and the relationship that you develop over the years. This year, I'm honored to introduce our first award winner, Ms. Tishan Cresswell.
I'm so glad that we get to put Augusta on the map. Can Augusta stand up? It's touching, it's heartwarming because you feel like the work that you do every day when you don't deserve anything for it, you know, you're doing it out of the kindness of your heart and this is your passion and this is what you love to do. And so to get awarded for that and just to put Augusta on the map is wonderful.
The great honor to introduce our physician who's received the Award of Excellence. That's Kevin T. White. Many of you know him very well. He's chief of the Spinal Cord Injury Center at the James A. Haley Veterans Hospital in Tampa, Florida.
Thank you to the PVA and to everybody who participated. You know, I was very surprised to be nominated and receive the award, so it's a huge honor. Never expected I'll be up here like this, and so I thank you all for everything.
The next award is for an occupational therapist, Janice Kim. Janice Kim has been working at Long Beach VA Spinal Cord Injury Unit since graduating from Cal State Dominican Hill in 2004.
Hello, thank you so much, PVA, and all those who had nominated me. I'm just merely a person in therapy, just, you know, part of the team. We have such a great team at the Long Beach VA, and we just work so well together. So this is for everybody back home. Thank you. Oh gosh, it really means the world. I think it's such a great honor, you know, to be selected, and I know of previous recipients, like my supervisor, and she's really, really high up there. So even just to be compared in that caliber, but you know, it's because I have such a great team. Like at the Long Beach VA, we work hard, we work well together, and I don't know what I'd do if no one did as well together as we do, so.
And last but not least, we have an award for psychologist. Kissa Christie, PhD, is a clinical psychologist who has worked in healthcare and health policy for nearly 20 years. She earned her BA in neuroscience and behavior from Mount Holyoke College. She completed her PhD in psychology with specialization in health psychology at the University of Southern California, and her pre-doctoral internship in health and behavior at the University of California, Los Angeles. A Bruin and a Trojan?
Yes, I know.
That's hard to do.
Thank you so much. Thank you to the PVA. Something that sort of drives my work is this idea that we're not alone, right? As patients with a new injury, We are there with them through the devastating parts. We are also there to celebrate, the milestones, the accomplishments. We are there with the family members. We are there with our teammates. We are all here as providers. And I just think seeing people in this room, you can feel the energy, you can feel the commitment and the passion. And it's an honor to be acknowledged and celebrated and to be part of this. Thank you all very much.
Now, you may be wondering, what in the world is this Defense Department organization doing in brain science? And it turns out that whenever I think of the brain, I think of how it's helping military personnel do their job every day. Right? The brain and the peripheral nervous system is very much a part of a military service member's ability to control complex systems, learn complex tasks. It's a part of the extraordinary stress that those people are under. And then ultimately, if that person sustains injury in service of our country and protecting our freedoms, the brain can often be injured. And it can take away their ability to serve. It can take away their ability to perform all of the things that we hold so dearly in our everyday lives. At DARPA, we have a number of programs that are just focused on the brain. We have a number of programs that are focused on the peripheral nervous system. And we have sub-projects in there that are kind of at the intersection of both. So yes, we do have some performers that are looking at direct neural interfaces from the brain to stimulate the spinal cord, stimulate the peripheral nervous system, to do all kinds of combinations thereof. So, from a scientific perspective, I see a continuum of those technologies, and I'm trying to position the office and the agency in such a way that we have the best shots on goal for all of those things, and that we'll have some winners out of those projects that will ultimately make their way into the clinic.
And just the advantages of an SCI center, it's an organized, comprehensive management plan that's developed for each patient. You have well-trained multidisciplinary staff. The facilities are designed for needs of the SCI patient. There is peer support available at these centers, and they get lifelong follow-ups.
The key here is multidisciplinary care, getting all these services together. We do this certainly in our clinic. I know a number of you do this as well. And it really is the optimal way to deliver care in these patients who have so many needs and require so many services and, of course, have limited mobility.
Really, for most MS patients, care is supportive. So it's symptomatic treatments.
Pain is common in ALS. It is treatable. You need to use your team and really advise your patient to be proactive, to describe the symptoms that they're having, and use the local team to come up with the best care plan.
Some of the other barriers that have been identified for women veterans include lack of transportation, difficulty finding childcare, lack of awareness of benefits and services, one of the reasons that I'm here today to share information about that, and being perceived as victims rather than as assets. All of these are areas that our strategic partners can affect.
Our women veterans are a much higher rate of suicide than their civilian counterparts, 5 to 6 times more likely to commit suicide than a non-veteran in the same age and situation. Your patients are not immune from feeling desperate.
We're committed to continuing to take care of our growing population, and we're going to always be here to serve you.
Well, I was surprised, so I didn't even know what the drawing was for, so it was good. Don't have to deal with some of the paperwork that comes along with VA funding, so just easy access, easy to do. Interaction with colleagues, I like the expo. We get a lot out of the new technology, so being an OT, dealing with a lot of wheelchair seating and mobility, we got a lot of good vendors here, so good information there.